I would like to call the Neighbors of Dunn County Standing Committee to order here on July 17th. And call roll. It looks like everyone is here except Gordy. And he had talked to me and said that he wasn't able to make it, but he was going to try to Zoom, and he hasn't? No, okay. So we have a quorum. Next up, approval of the minutes, which should be short considering the meeting last time. Barb? Okay. Supervisor Lyon first, Supervisor Laufer second for approval of the minutes. And any other comments on them? No? Then all in favor? Aye. Any opposed? Minutes pass. Do we have any public comment? No? No public comment? Now, the next up is a request of the chair presentation of 2026 wage proposal. But Supervisor Lyon needs to leave a little bit early, and she heard that last night. Would it be okay if we moved it behind number 6? Okay, thank you very much. So unless there's any objection, we will go right down to number 6 and Community Mentor Administrator Report and get back onto the wage proposal after that.
Okay.
Thank you, Carmen.
All right. So as always, we start with the Quality Assurance Steering Committee updates. So our QA committee met last week. The majority of our conversation was about our most recent survey, which we discussed in this committee last month. So talked about the different audits that we are doing to make our corrections per our plan of correction that was submitted and accepted by the state. So all of our survey citations were corrected and our plan as well as our proof of our plan were accepted from the state of Wisconsin. So we are relicensed for another year. So that is always a good thing when they get that letter in the mail saying you did it. So we went over that, talked about all the different things we were putting in place, as well as we went over our quality indicators. So this is something that we pull quarterly. They are basically the metrics that compare us to other nursing homes, both in the state and national averages. So it's everything that is submitted through the minimum data set or MDS, which are the assessments that we do for residents. And it just compares things that could indicate quality or quality concerns. So some of the big ones on there are falls with major injuries. So if someone has a fall and gets hurt, psychotropic meds are on there, indwelling catheters, anything that could be considered a quality statistic is on there. We do range a little bit high, but that is also because we do take some more complex people than a lot of nursing homes. So we do look at that as part of that as well. So yes, we may be on the higher end of things, but we also haven't had bad outcomes from those higher end of things. So everything comes with a little grain of salt on some of those, but we do fairly well still, and we review those quarterly. So we did that this month. Is there any questions for QA?
It doesn't look like it.
Okay. Employee activity report. Chris is on vacation today, so I will go over this. Pretty standard to our norm this month. So we had 9 direct hire interviews. We had 2 agency interviews. We had 9 positions for direct hires offered and 9 accepted, with 0 being higher than a step 3. We did have quite a few younger applicants this month, homemakers and CNAs, so that was nice. So we didn't have any nurses, that's why there's none higher than a 3. We had 3 resignations, 1 part-time homemaker for personal reasons, same with a food service worker, and then 1 part-time LPN. She received her RN and wanted to go to the hospital setting, so she's working at Mayo now. The open positions were adjusted below. We had no work comp last time, and we had no COVID positive last time as well for the month. Any questions on employment?
Yes, Supervisor Laufer.
Yeah, Carmen, it looks to me like we're increasing in the number of employees then. We're gaining. Will that lead to opening up the last wing fully eventually? Do you look toward that or?
So yeah, at this point, we haven't contemplated opening Arrowhead. We have extended the amount of people that we have admitted to Fireside. So right now, we have had roughly 20-ish people, 20 to 25 people in the central neighborhood, and that's filling Fireside halfway. We have been increasing the amount of people that have been admitted to Fireside. So that means we're hoping to have 2 full houses in Central instead of 1.5. We're going to do that prior to opening Arrowhead. It is something that we've talked with both Brady and Austin about for Arrowhead. If we get to that point, we will have to do a significant amount of updates to Arrowhead of things that we've thieved from there to not purchase in the rest of the buildings. So things like TVs, the stove parts and things like that, since they weren't being in use instead of purchasing new. So we're not there yet, but that would be hopeful. Yeah.
Okay, thank you.
Great, that sounds good. That's next up.
Okay. Next is a CNA training program. The only update I have for that is a new class started this week on Monday. So we have a full class right now. And the fun fact of that is 2 of the class that is there are actually NDC employees. So they're homemakers that are becoming CNAs. So that's a really good thing. And the whole reason we wanted the class. So we're really excited about that and they plan on staying with us once they become CNAs. So yeah, that's wonderful news that it's working out how we wanted it to. Any questions on that?
No, just keep the good news coming.
That's the goal. So resident referral report is also in your packets. We had 114 residents at the beginning of the month of June. We had 71 referrals, so staying pretty steady on that. We had 10 residents admitted and 61 residents not admitted. Ended the month at 112. We had 2 transferred to other facilities. We've talked about this the last couple of months, is that we're seeing this more and more of people that are admitted to us because where they wanted to go weren't accepting admissions or were full to what they could staff, and then moving there. That's also happened the other way around. We've had a few people admitted to us from other facilities. So that hasn't been common in past years, but as facilities are full, hospitals are getting them wherever we'll take them and then moving them once a facility has a bed where they would like to be. So we had 3 deaths this month and we had 7 residents discharge home. That number keeps going up because we are having more and more rehab residents. That's in Fireside typically. So that's a great thing. In and out is good for the rehab people. So. And our referral sources remain the same, the Mayo system, and then we also had some from Amory this month. Any questions on referrals?
Doesn't look like it.
Okay. We have Austin online and Brady here in the room for the environmental report, so I'll hand it over to them.
Morning. Going over the survey, Life Safety got 3 sites, pretty minor. One was a dirty sprinkler head and a penetration in the ceiling was missing behind a pipe. It was pretty minor. The electrical outlets we got dinged on as well because they weren't hospital grade outlets where hospital grade equipment can't plug into an outlet that's not a hospital grade outlet. So we had to change out 6 outlets in the central building to hospital grade outlets. And then we also had to remove an emergency light in the generator because it wasn't legal the way we had it. So it has to be hardwired in instead of on an extension cord. So that was removed and those are all fixed. We also had a city water inspection that the inspector from HydroCorp came in. We had some issues with some soap dispensers on our washing machines. Apparently the way we had them plumbed wasn't good enough. It was pretty minor. We just had to kind of redo the way we did the plumbing. It was a little ridiculous in my book, but it is what it is, and it's been fixed now, and they're scheduling the inspector to come back out for that. The oven for the kitchen is scheduled to be put in on July 30th, so we're getting things in place to get that removed so that when they come in, they just have to install. We're also working with Summit, preparing for all of our extinguishers have to be hydro tested this year. So working with Summit to change out our extinguishers for basically an exchange program where they bring some temporaries in and they take them back to their shop and service those and then bring them back. Everything's going good with fire drills and everything's going well with lawn care. The seasonal guys have been doing a lot of work with that. And then we've also been getting some help from Government Center on some of the weed whipping and stuff like that. Seth and Rod helping with that. Other than Bob kind of working hard on work orders and things like that. Kind of worked with Carmen a little bit on budget items. And that's pretty much it from facilities that I know of, unless Austin has anything.
Nope, that sounds great.
Any questions here? Now, all the things that you say are fixed, you guys do them yourselves, huh?
Yes,
Yeah.
yep.
That's great. Hydro testing? I'm just curious.
For the extinguishers?
Yeah.
That they actually have to take the extinguishers, evacuate them, and then they basically pump them full of water and they test them for basically testing the integrity of the vessel itself.
Okay.
And then refilling them and then bringing them back.
Always something new.
Yes.
Yeah. Thank you, Brady
Thanks.
and Austin. All right, private pay rates, 6F, fiscal year 2026.
All right. So for those of you who have been on the committee for a couple of years, and 2 years ago, we had a fairly significant rate increase of 9%. That was because we had fallen pretty significantly behind other facilities, as well as with higher federal and state inflation rates and things like that. We were well behind, as well as our private pay rate was significantly lower than the Medicaid rate at that point, once we had significant Medicaid rate increases. Last year, we decided to do a 3.5% increase, which is a little closer to the norm. Since I have been here, we've averaged about a 2 to 3% increase every year. To meet inflation was kind of the goal without trying to cost everyone out of private pay. And then we did get behinds. That was the 9%. That was the first year that I had brought the private pay rate to committee, mainly because of the significance of the 9% increase. So I've put it on the agenda again as a discussion item. For the first round of our budget, we put in a 2% increase, just the standard inflation rate. That's something that we could still change. It's in there currently. For reference, this affects less than 10% of our residents. 75% of our residents are on Medicaid, and then the rest of the 25% is made up of private pay, insurances, Medicare, things like VA. So this is a small portion of our population, but it does affect people. So at this point, last year's or current fiscal year 25 is 337 is our current private pay rate, with a 2% increase that goes up to 343 per day for residents. I'm open to any ideas or suggestions for that as well. 2% is just what we currently have in there, and our budget does look good at this point for the first round. But if we would like to stay higher, to not have to have a significant increase in later years as well, that would be another thought process too. So if anyone has ideas or questions.
Supervisor Lawfer.
What did you say the current rate with the 2% would be? 340?
343. So we're currently at 337.
Okay.
So in a way, are you asking us for kind of a policy type thing of saying we should stay a little ahead of inflation, or
Sure.
inflation is fine, or?
Yeah, on the policy side of it, and we can then look at the actual numbers, but of a thought process of if we want to stay lower, since we can fiscally responsibly stay within only a 2%, or if we don't want to get behind the curve again, going a little bit higher to stay more with other facilities.
Any thoughts or discussion?
Carmen, what's the daily rate for other facilities, average out at?
So that's not a number that I have.
Mhm.
It's not typically shared between facilities.
Sure.
I do know that some other county homes, at our Wisconsin County Homes Association meetings were talking about this, and no one really threw out their numbers. But there was several homes that were discussing raising theirs significantly. Primarily, I think, due to the uncertainty with the Medicaid rates, as at that point, the state budget hadn't even addressed them yet.
Mhm.
So we are, on the state side of things, expecting for them to fund the cost to continue for Medicaid. On the federal side, we don't know. So,
Mhm.
at this point, I wouldn't be concerned with having significant decreases to Medicaid rates because we do have, the state Medicaid system has put in, more of it's at the median rate. So instead of doing just the increases by percentages that
Mhm.
were one-time things every 2 years, it is more of a set system now. So I don't have a huge concern with any decreases with Medicaid rates, but we may not see as significant increases either.
Thank you. I was gonna ask you about the Medicaid rates, so you've already addressed. Thank you.
Supervisor Story.
If I'm correct, I believe the Medicaid rates would not officially change until 2027.
Correct.
And so there is that possibility that they would change.
Correct.
that. So we'd be good to do 2 budgets
Mhm.
for the, okay.
Any other thoughts?
You want a motion?
Well, no, it's just a discussion item.
Mhm.
Okay.
We don't, yeah. Our goal, our job is to set a policy for her, is to say we always want it higher than inflation or lower or the same. And this is your recommendation and you feel comfortable with it? I do too then. And I don't see a need to go higher than inflation. It costs people money, even if it's only 10% of them.
Just for the record, Supervisor Wolf did join us.
Oh, great. Welcome, Gordy. Okay, then that was a discussion. Thank you for bringing that up. And you came just in time for us to look at the vouchers and financial reports. And I don't think you have a copy of them.
Hot off the press.
Hot off the press. Carmen, could you just summarize the Neighbors of Dunn County Financial, that first page?
Sure.
And just briefly talk about it so Gordy can hear it too?
Sure. So the public charges are listed on there. So that is our revenue source from residents paying to live at the facility. So we are currently sitting at $8,659,761 with a projection of a little over 17 million for 2025. And then through the other revenues of miscellaneous donations, interest, things like that, we are currently sitting at $8.7 million for fiscal year 25 and a projected out of $17.5 million for 2025. And then when we go down to the expenses, we have salary and fringe of a little under 4 million so far, agency costs of about 2 million, operating costs of 1.7 million, depreciation is listed on there, 176,000. for a total of 7,601,716, with a projected out of 16,116,578. So that puts us at a current of 1,158,419 in the black for current, and then for projected out of 1.4 million for 2025. So that is net, and then without depreciation, a projected out to be 2.1 million for 2025 in the black.
Any comments or questions? And of course, we got the broken out for each building. It's all pretty much the same ratios as it has been.
Can go over the agency staffing as well. So this has a breakdown of by month and then the total for 2025 and projected for 2025. When we look at the projected, that's the one that if everything stays the same of how we've done it so far this year, that's how we will end up at the end of fiscal year 25. And if we compare that to the end of fiscal year 24, we are $1 million less in agency costs. So we're very happy with that. We had a significant decrease in agency staffing. One of the big things is we've had very little agency nursing. Our bigger cost for agency staff is the CNA because we have more of them, but we've had significantly less nursing, and the nursing cost is much higher. So an RN hourly rate for agency can be upwards of $80 an hour. So that's a huge cost, even if we only have one of them. So we've been fortunate to have a lot more internal nursing staff. We still do struggle with the CNA coverage and have had some pretty steady CNAs that are agency, but decreasing that at all is the goal, and we're happy that we're projected to be close to $1 million less this year than last. Any questions on agency staffing? Okay. And then we go to look, if you go all the way down to the all nursing staff financials. So that's where we put together the agency staff as well as the internal nursing staff. So that's total cost of staffing the building for nursing staff. Because obviously with the agency staff, when we get rid of agency, then we are filling that position with an internal. So it's not erasing that $1 million, it's shifting some of it for cheaper. So it not lowering quite by $1 million, but if we do look at the projected total for 2025, we're right at 10 million for nursing staff, and we finished a little under 11 million, so 10,779,000 for 2024. So about $700,000 less to be staffing with internal versus with agency staff for those positions. So for roughly the same amount of residents, we've had pretty consistent with the total of residents at this point. So if we were to increase our census, those numbers would go up, but then we would also be offsetting that with more revenue. So any questions on the staffing costs?
Just a lot of work has gone in over the last 3, 4, 5, 6 years to make this happen. So appreciate it, and not just from Carmen, but your whole team and people sitting behind us.
Yeah,
So that's great.
So on the last page of the financials, we have the senior meals and the depreciation. So senior meals, as I talk about every month, is our goal is to break as even as possible, as we are charging basically another county entity for those. So our goal is to not make money, is just to kind of keep it as even as possible, which is what we've been doing. We also have to incur some costs when it comes to like overhead and things like that. So that all gets figured out in the end because we do that as part of our cost report. Because any space that is used for non-nursing home care things, we have to pull out of the cost report because it didn't cost us to do that to care for the residents. So those all get adjusted at the end of the year, but it looks good thus far. And then we have depreciation on there as well, which we've only had the first quarter of that because that gets done quarterly.
I think that wraps that part up and we don't have the vouchers, so we'll just postpone accepting them until next month. Do we need to do anything with the financial reports? Just accept them?
Mhm.
Okay, I'd take a motion to accept the financial reports as given. Supervisor Laufer and Supervisor
Okay,
Wolf.
thank you.
All in favor? Aye. Any opposed? It passes. It is accepted. Next meeting time, dates and announcements. You have that? Meantime, does anybody have any announcements?
28th,
28th.
August 28th.
Well, we can't skip to adjournment, but I think we've covered everything. Brady, thanks for coming in person. It's always nice. If you want to stay, you certainly can. And Barb, do you need to leave now? Okay. Thank you for,
So much I need to take.
okay.
I was thinking that Supervisor Kinnear could do the presentation, because he's heard it 3 times.
I am gonna say it would have been a 27-minute meeting.
Okay, so we're gonna go back to number 5 at the request of the chair and the chair's leader. Presentation of the 2026 wage proposal. So Sarah's on? Good morning.
All right, good morning. Thank you for having me, us. My name is Sarah Stansberry. I'm the Talent Development Manager in the HR department, and I oversee a few different functional areas in the HR team, one of them being performance management, which we'll talk about today, and then the others being training and development and recruitment and retention. So the reason that we're here is to share with you what we've been sharing with staff about changes to our performance evaluation system process and also what we're proposing for wages for 2026, and to give you a chance to see how we see these two things interplaying, and then also to ask any questions that you have. I know some of you have heard this before. Maybe you have new questions. We're happy to answer those at any time throughout. So we'll start with performance. Back in January, our leadership staff, so the county manager, assistant county manager, department heads, set performance evaluation as kind of an organization-wide goal, to have those done, completed, and that kind of bubbled to the surface because of the satisfaction survey results from 2024. We just knew that we needed to do that more effectively. And the more that we dug into the process that we had for it, the more that we realized what we were doing wasn't working for people. We heard that a lot from department heads, from managers. We heard it from employees. And so we had a lot of conversations around how do we make this better? What does this look like for you, ideally? Pulled together some process improvement groups. Carmen was in those groups, and we learned a lot. And what we learned was this really needs a full overhaul. And so when we looked at implementing something new, we knew that we had a few goals, which is what you're seeing here. The first goal that we had is we really just want for employees to have regular and ongoing feedback from their manager so that they know where they stand as it relates to their performance. We know from research, kind of general research about the work world, if you look at some of the big hitters like Gallup, ICMA, that annual evaluations really aren't enough for someone to have that true development happening. We also wanted a simple system, so something that could be used everywhere across the county, knowing that what staffing looks like at NDC is way different than what staffing looks like on the HR team, right? We're talking about over 100 people versus 8 people, so something that works for both. While balancing accountability, so doing what we say we're going to do, having some kind of oversight to that, some sort of auditing of that, and then really at the end of the day, not overburdening people so much with a process that they lose sight of the real task here, which is to connect with people and to invest in people. And then lastly, like I mentioned, we have done the satisfaction survey 2 years in a row. The things that consistently bubble to the surface for us are the following statements. I have regular check-ins with my manager. My manager holds employees accountable, and my annual performance evaluations help me identify areas for improvement and growth. And what we know is we score lower in those areas, so we need to focus on them and invest in them. So what this process looks like is performance check-ins that will happen 4 times a year, so quarterly, on or about January 1st, April 1st, July 1st, October 1st. This is a little bit different for NDC because the volume of direct reports for nursing staff is significantly higher than in other areas of the organization. So we worked with Carmen to talk about what would work in your work area, and we landed on doing this twice a year. So this year it will be July and October, but going forward it will be April and October. What the process is the manager prepares for the conversation. That might include them looking back at previous performance information, really reflecting on the last quarter. They might ask for the employee to bring some sort of self-reflection with them. That's optional. And then they'll meet with the employee, have the conversation, and only after the conversation will they fill out this performance form. And the performance form it's 1 page. It's got pre-populated information at the top with their name, hire date, department. It's got a drop down for a performance rating. And then at the bottom, a box for a narrative where the manager will capture the conversation. So it's really not meant to be the manager writing, this is what I think about the performance. It's meant to be, this is what the manager shared with the employee, this is what the employee shared back, and it's meant to be holistic. There's the option to attach some additional documentation to that. We know at NDC there are some specific regulations that they need to make sure are happening so they can still use those forms and attach them to this process that takes place in NeoGov, which is the same system that we use for recruitment, housing personnel files, onboarding of employees. when employees have to update like their direct deposit information, all of that takes place in that software. And then once the form is complete, there's visibility to it. So the employee can see it, the manager can see it, the manager's manager can see it all the way up the chain, and then HR can report on it. So we can see, are there forms that aren't complete? We can audit them. So we can say, are there areas where we're seeing concern about either the ratings or what's being written in the narrative? So that's that accountability piece and that oversight. So when we say that there's visibility to it, what we mean by that is Carmen could go in, and if there's a nursing staff member that's had a form completed, even though they don't report directly to her, she can go in and view the form. So that will help her to provide coaching to her staff as well. On the first white page that I gave you, so it should be the second page that I gave you, is a performance check-in guide. This check-in guide was given to all managers. They went through a training in the month of May. It was a 2-hour training on this new process and on best practices for having effective performance conversations, what to do, what to not do. And we've also gone around to departments and we've given this document to staff as well, so they know exactly what managers might be looking at. What's on this form is what you're seeing as kind of a best practice guide. It is not meant to be something that managers have to use. It's meant to be a starting point for them. So when they're looking at someone's performance and they're wondering what inputs they should consider, it's those 5 questions that are at the bottom of that first page. At the top, you'll see the performance ratings. We used to have a 5 rating system. We're going to a 3 rating system. And what those are exceeds expectations, meets expectations, and needs improvement. And so we'll talk a little bit about what those are. Exceeding expectations is performance that's consistently going above and beyond. So that consistency is really important, right? Someone who is doing that with regularity. They are taking initiative, they're innovative, their impact goes maybe beyond the typical expectations of the role. They're adding value. There are no areas that require improvement. That's not to say that employees don't have maybe a place where they can grow or learn, because that's true of everyone. No matter what rating you get, there's always something that we can all learn. Meets expectations is performance that consistently meets the expectations across the key areas of the job. And when we talk about those key areas, we would be looking at the job description. So are we meeting the mark on those things? That's someone who's really solid, dependable, reliable, effective contributor. We hope that everyone is getting this meets expectation. This is where we want people to be. This is a good rating to get. We say meets expectations is like getting 100%. Exceeds expectations is like getting 110. Again, there may be areas for growth, but nothing requiring improvement. And then lastly, needs improvement is performance that doesn't meet the criteria of the role. There are gaps, they're recurring, they're significant. Improvement is required in this rating. So it's performance that cannot continue on this way. And if it did continue on this way, we would be looking at something like a performance improvement plan or disciplinary action. So we would expect someone not to get this rating over and over and over and over without there being action taken on it. But what we also know is it's fair to let people know where they stand, and it's fair to share with them what they can do to get to the next level. And that's really what we're after here. We have not given managers like a quota of how many employees they should have rated in each area. We've told them we just want you to assess the performance accurately, however that looks for your team. Are there questions about this performance process?
Supervisor Laufer.
Yeah, if the worker happens to get uh, needs improvement, um, performance, rating, are they, are they able to, um, object, or are they able to talk about why they received such a rating on that? And can that be, if there was special circumstances, can that be um, readjusted again or whatever? And does it reflect on their permanent record of employment and stuff? If they would go from this employment to another employment, does that follow them on their record then as well?
It is in their performance file in NeoGov, so it's in their personnel file. There are kind of specifics around whether that's like open record or not. Your other question about can an employee object? Absolutely. We hope that those conversations are happening with the manager. On the back of that white form that I gave you is a colored chart, and it is something we're calling the core values rubric. These core values were adopted by the board back in fall, and these are behavioral indicators of what we would see in the workplace as needing improvement, meeting expectations, exceeding expectations. It's meant to be like a starting point framework for employees and managers to come together so that if a manager says, I think you're meeting expectations, and the employee says, I think I'm exceeding expectations, they can sit down with this framework and say, what are we seeing in each category? So an example is one of the values is betterment. And needing improvement in that category would be someone who's dismissive of feedback or maybe resistant to change. Meeting expectations would be someone who's accepting that feedback and change, and then exceeding expectations is someone who's seeking out feedback. So you can kind of see the progression, and we want to be really clear with people about the progression in each area. We would say if an employee sits down with their manager and they're not able to come to a resolution or agreement, that is going to happen sometimes. At the end of the day, it is the manager's job to assess performance. Sometimes the inputs from the employee change that outcome, and sometimes they don't. And we want managers to get clear enough that they stand behind what rating they're giving and why they're giving it. But also, we would encourage people to work kind of up their chain. So if there's an RN at NDC who meets with their ACM and they don't agree, that the director of nursing would become involved and the three of them would sit around the table and so on and so forth. We would also say that if there is ever someone who feels that there's a policy violation happening or like retaliation happening, which is a policy violation, straight to HR. We would want to be involved in that.
Okay, thank you.
Any other questions?
Sarah, just for all of us again, kind of give us an idea of what happens the quarter or the 3 months before there's an actual evaluation. What's happening with the administrator and what's happening with the employees. It's not like they don't talk.
Mm-hmm.
So could you tell us what's expected of the evaluator?
Sure. So we would say a lot of employees are having check-ins with their manager more than 4 times a year, more than 2 times a year. And especially at NDC where people are working together all the time, right? That collaboration is happening. If there's something that is needing improvement, we would expect that the manager isn't like waiting for that performance check-in. That should be addressed immediately, right? It shouldn't be a surprise when July rolls around that that employee, now all of a sudden, something 2 months ago that they could have corrected is being addressed. So those conversations are happening all the time. The 2 times a year that these check-ins happen is really when the documentation happens, and also when two people have focused time to say, hey, let's call this out and say we are having a performance conversation. So it's really the kind of formality of the process. It's not meant to add any work to anyone's plate. It's meant to have that consistency in conversation and in documentation. And I hope it's okay if I share this. But we have met with the leadership team over at NDC, and from Carmen's feedback, it seems there's a lot of receptiveness and kind of excitement around having a framework and, kind of collecting things that like, oh, I want to make sure to talk about this. I want to make sure that, we have a conversation about it. So it's really providing that structure. And as an organization, I would say this is, at least in my time here, maybe the clearest that we've been with both employees and managers. We've said the heavy lift here is on managers because hard conversations are hard to have. And we've worked really hard to equip them toward that end. And I believe in them.
So you would expect at NDC, for example, in that 6 months prior, the manager is going to be touching base
Oh, yeah.
frequently. Sometimes daily, I would think, but frequently they work with them, they see them. It's not just every 6 months, or in other cases every 3 months. Oh, nice to see you again. I'm going to evaluate you even though I haven't worked with you.
From Carmen probably could speak even more to this, but from my understanding, they have regular like touch points, huddles, team meetings. They send out regular email communication about like if there's an expectation that's like, hey, we got to really tighten this up as a group. That those things are already happening. It's just that kind of individual anchor point that's happening those 6 months apart. Is that accurate?
Yes, very much so. I think especially if there's performance concerns, those conversations are happening all the time. So we deal with people's lives. So if there's a performance concern, we're addressing it immediately. So those things are, no one's surprised if we are saying there's concerns because typically it's something that would affect a resident, especially with our frontline staff. So those conversations are happening daily. And then as well as team meetings happen, our management team and interdisciplinary team meets every single day. And then there's staff meetings happening monthly for every other position. So they would know.
We look at other departments and they're doing their own version of that, right? Some of them have huddles, some of them, like in the HR team, I meet with my director once a week. We meet as a team every other week. In DHS, a lot of supervision is happening weekly. So it depends where you are within the organization. That's what we mean when we say like flexibility is needed, because it depends on the role and it depends on the needs. What's possible and what makes the most sense in terms of how to connect. But this is something that we feel is important to have consistency in. Any other questions?
I'd like to follow up on Supervisor Lawfer's comment. You asked something about does the person have any recourse if they disagree with them? And you listed several things, and I advocate for the ability of a person to actually put into their file saying, I disagree. The methods you listed are really onerous and difficult to do often, to go up to the next chain of command and say, well, hey, my boss is wrong. That's tough to do. And an easy way would be to say, I believe these facts are wrong, and here's the thing, and it's 4 sentences, and it's in their file. And that's not the way it's set up now, but that's what I would advocate. And that's kind of what you brought up, I think. And I've, as I mentioned privately to a couple people, I've been through multiple mediations, arbitrations, grievance procedures, and it is awful. It's very difficult, and most people wouldn't do it, even if they were totally right. So that's just my 2 cents worth again.
Just to add to that, Mike, as an employer for many years who's employed a lot of people, there's sometimes are mitigating circumstances that are outside the workplace that affect people's performance, spouses, children, relationships outside the workplace that actually can contribute greatly to the performance of a person at work, which sometimes people aren't willing to share those mitigating circumstances that are happening to them outside. And that's why it's very difficult as a manager to seek those things out and see if you can help to correct those things which are, help or contributing to perhaps a lack of performance at work. And I know that's not professional to do that, and that's an area of growth that needs to happen in that person's life. But it's very difficult as a manager to put your finger on some of the things that can affect workplace performance, and especially when you have a good employee that all of a sudden takes a turn for the worse, and it could be something related to something outside work, not due to their boss or other employees or anything, but something outside of work. And so those circumstances that are occurring there, are they considered by management to help that person through some of these things to get them on the right track again and stuff? I know it's a tough job as a manager. It's very, very difficult to work with people that are struggling in areas of their life, and that affects a lot of other people within the workforce too as well. So um, I'm a great proponent of having a person in their process of growth being able to present that on their form so that temporary situation in their life doesn't affect them throughout the employment of their other employment later on if they happen to leave that facility or something and follow them along.
I agree that being a manager is really difficult. Being an employee is really difficult. It's hard to, we think like, oh, well, it's hard for the manager to give feedback. It's hard for the employee to receive feedback too. What part of our performance management training that was required for managers was some of those signs to look for that maybe something else is going on, and maybe we need to explore if there needs to be an accommodation here. So an example would be someone whose performance is solid for years and suddenly we see a drop, right? And, kind of, I guess, educating managers to ask first and not maybe assume that we know what's going on. Because also what we know about the workplace is sometimes the first person that you have to tell about a diagnosis or something going on in your family is your boss. And that's hard to do. Managers are kind of building this out in different ways for themselves. So, like in the public health department, they are sending the narrative, they're emailing it to their employees first and saying, this is my recollection of the conversation. Do you have any additions or, anything you want to add? We can always attach something that an employee brings or writes. The forms are open for 45 days. So there's time in there where the manager can start the form, and then if something needs to be added. We also can go in and if someone wanted to add something to their performance file later, they want to type something up, we can do that for them. Mm-hmm. One of the challenges, we kind of went back and forth and back again about having a space for employee comment and or employee feedback on the form itself. When we looked at our old process, that was part of it. That was part of the old process. And it was part of the reason that the evaluations weren't done, because employees weren't going in and adding comment, and then we're out of compliance with the ordinance. So trying to educate managers, educate employees, and provide them different mechanisms to do that don't feel cumbersome. I will also say that we have done a lot of training with managers on feedback and confronting performance issues. I think we've had in the last year and change probably 1,100 manager hours spent on that curriculum about having conversations. The plan is that in the fall, we offer that to employees as well, because we know giving feedback up is not easy. And we expect for managers to create an environment that is psychologically safe for employees to share. We want a feedback culture. Thank you for sharing. Okay. Oh, I didn't share this yesterday. What day of the week is it? But the next form that I gave you is an FAQ about performance and wages. We have made that available to employees a couple weeks ago. Wanted to share that with you as well. We've emailed it out to everyone. So we are continuing to collect questions from employees about these processes, and we'll continue to update that as a way of communicating out to them what concerns, challenges they see.
So, uh, you might wonder why we're going to every committee to talk about this. So obviously this is a significant change, and the performance work that Sarah just went over is typically something that just is managed within administration. But with some of the changes that we're doing, we wanted to make sure that you were fully aware of what we were doing and how these performance check-ins and that whole performance management process was happening as we go forward. So the big thing, and the reason we wanted to get to all of the committees to talk about that is, excuse me, in the end of the month at the next county board meeting, assuming the Committee on Administration approves an ordinance update to our personnel ordinance, we are proposing to make some changes to that ordinance that'll impact how we manage wages and salary increases within the county. So our recommendation, or part of the proposed changes, are to eliminate the step system from our ordinance. So currently our ordinance requires us to have 25 grades. So grades are the horizontal rows of which a salary or a position falls on. So if you are the county manager, you are on grade whatever, and then that has 11 steps within that category. So we have grades and we have steps. We are not looking to change grades, so that minimum and maximum that an employee can be paid would still exist, and that's not changing from what it is right now. What we're looking to eliminate is the 11 steps within each of those grades, which defines where somebody's salary can move and how they move up and down that range from the minimum to the maximum. So, and then the other change that we're looking to do is to provide our pay increases based on the performance check-in that will happen in October. So current ordinance requires a satisfactory annual review in order to receive a step. With the elimination of steps, we have to kind of go forward with how are we going to provide those increases to employees going forward. So that's the basic summary of the ordinance change that you'll be seeing in July and September, because technically not a board meeting in August, going forward. So we just wanted to give you a little heads up on what's happening there. Then with that ordinance change, we will be making a recommendation of how we will go about managing pay for 2026. And so this is somewhat of a normal process that we would follow, in that in September, we would bring to the board a proposal for how we would manage wages. That in the current form would look like a 2% cost of living plus a step, right, as a recommendation. With the elimination of steps, we have to kind of change how we're going to go about that. So this is what that is proposed to look like for 2026. And I do want to point out that this is the 2026 proposal. It could be different numbers in all three categories in 2027, 28, and going forward. So a couple of big changes. So needs improvement currently in this proposal has no increase. In our current model, people that have a needs improvement or a low increase would still receive what we would call that cost of living increase. So they'd kind of receive that 2% increase. So with this change, and once again, we expect this to be a very small number of people that already know kind of where they fall, but they would receive no increase. So they'd kind of fall back a little bit in that grade as it moves forward. The next item in there is meets expectations. So this is kind of, if you think about the way it is now, this is kind of the way it is now. So those people that meet expectations would go up 2.75%. Don't do the math on the numbers because they become rough, but as part of this, we're looking at like a 2.25% increase to the grade. So that cost of living increase would be about 2.25. So then that includes a 0.5% increase. So a previous one would have been like 2.25 plus a step, which is 2.75. And this is 2.25 plus a 0.5%. So less than that. The exceeds expectations is proposed to be at 3.25. So this is something that's new. That's not something that exists in our current model to kind of recognize those that exceed expectations. And you can kind of look at that as being 2.25 plus 1%. And then we have a little asterisk at the bottom. And so this will be something new to Supervisor Story, but based on the recommendation of the Committee on Admin, as they've seen this before, we are looking to make sure that those people that are at the top of our pay scale, so currently we would call those people at step 11, but the people that are at the maximum raise, they typically don't get anything more than that, in this case, 2.25%, right? So they couldn't go up another step because there wasn't another step for them to go, so they just received that cost of living. So we're looking to propose that they would receive a bonus that kind of makes them even for that additional amount. So their base pay would not go up by 3.25%, but they would receive that amount of money in the year to kind of make up for that difference. And that's truly to reward those people that have been here long and have demonstrated the ability to be at the top of that scale and are continuing to still exceed expectations. We want to continue to reward and keep those people. Those are our best and brightest top performers. Their base pay will go up by the cost of living, as it does now. So in this case, it would be a 1% of their salary would come as a bonus. So that's something that's new that didn't exist in the current model that I do think will help a lot of our people. It's about 17% of of our staff are at that top level. And there's lots of terms that kind of come out there of the quiet quitting or the retiring in place that really when people get to that top level, there's little motivation to kind of go to that next level. And obviously there are people that continue to go to that top level, but it's always nice to be able to reward them or to continue to motivate people so that they don't fall into that category. All right. So why? So I talked about it a little bit. So the steps, each step on that 11-step system increase is a 2.75% increase from step to step to step. So as we go forward to make a recommendation and we look at how much money we have or how much of an increase is kind of the market is showing at this time, we're limited to 2.75 or 0. So we can do that 2% cost of living, and then your choice is 2.75 or 0. And so as we look at the available funds and where that is in the marketplace, when that falls somewhere in the middle, it becomes a really hard decision. And we've seen, I think, twice in the past 10 years that the county board did not provide steps. So they provided a cost of living, but they didn't provide steps. And our thought is, as we look at that, is maybe we can't afford steps, but we can afford 1%. We just can't afford 2.75. So that's what we're looking, is to build a model that gives us the flexibility to provide something as opposed to going all the way up or nothing. And we can kind of get into a little bit the fiscal sustainability of that. So when you talk about a 2% cost of living plus a step, that's about a 4.75% increase. That's a really good increase. I know people, everybody always wants a greater raise, but 4.75 is on the high side of what you'll see in the market if you go talk to your neighbors or others. And we're happy to give that, and we would love to. But I think we need to, it's my job to kind of provide you with what we think is the right number as we look at the market and our available funds. So 4.75% increases cost us about $2 million a year in overall payroll. And as we can go over all of the county funds, and we have some slides that'll kind of go over that, but our revenues don't go up that much. So when we talk about $2 million, it's where are we going to find $2 million? We're not going to increase the cost of our services because we're not allowed to. So we really have to find that within what we already have. Now, some of that money is made up through grants or reimbursements. So we're in the NDC, right? You talked about rates and how you're setting that. That's how NDC pays for those increases. But the county in general doesn't necessarily have the flexibility to say we're going to set our rates to align with inflation. Ours are defined by state statutes, and that's what we have. So, and then the next component of that is as we look at our employee satisfaction survey, we had 25% of our employees cite dissatisfaction with compensation. And you say, so here we are proposing to decrease raises if 25% are dissatisfied. But we look at that and we look at 4.75% increases and say, like, that is a really good number. How could you be dissatisfied with that number? So we really wanted to dig into it, and we've met with different employee groups and employees throughout the county to kind of talk through what is that. And what we hear, not from everyone, but from the loudest voices that were, or I shouldn't say the loudest, but the most voices that we hear coming through that was really, it was a dissatisfaction with how much I was being paid versus how much that person is being paid. It's really understanding that some employees are high performers and they see some of their colleagues that are maybe not coming in and putting in their full effort, and they're receiving that same raise. And so that's where they were dissatisfied, is I'm working really hard and I'm not being rewarded for it. Everybody is. So that's where we kind of made that little change around those employees that exceed expectations to be able to to see if we can do a little work on that number. And 25% of our employees being dissatisfied is a pretty good number that we really need to focus on coming up with solutions to be able to better that. And then a couple other statements from the employee satisfaction is employees were need for sorry, I was trying to read this as a statement, right? So need for meaningful and effective management is kind of a takeaway that we got from that survey, and that accountability is a concern. And we talked through some of this, and as we go through performance management, so accountability, there was a statement that says, "My manager holds others accountable," and that was another one of those high ones where employees did not believe that their managers were holding others accountable. Now, on the other end of that, they thought that their manager was right on with them. So, so there's a little bit of a distinction there, and that's where we really came in and focused on that performance management over the last couple of years to really focus on management and making sure that managers were having those discussions and letting that be known. And we do say, I mean, as part of that is if your manager is holding someone accountable, we don't want the other employees to know that that's happening. So there is a component of that too, right? As you're having a performance management conversation with one employee, it isn't the other employee's business that that's happening. So they don't always know that that's happening, but that is something that we do want to focus on and making sure that we are having those conversations. So then we get into the money. We've talked in the past at board meetings about net new construction. I talk about our revenues and how we generate money as a county. Net new construction is the primary way that is the primary. It's the only way that we can raise our levy. And that says that we get to raise our levy based on the amount of net new construction that happens in our county. This is a graph that kind of shows what that's looked like over the last 10 years. And you can see we live right around that 1.5%. Last year it was 1.47%. So that means our revenues are going up 1.47%. So you put that in context, we were giving raises of 4.75%. So our expenses are going up and our revenues are not keeping pace with that. So we needed to come up with some tools to be able to provide me to propose and for you as board members to adopt that can help us align our costs and our revenues. So a few more statistics here. So this graph shows our salary and fringe expenses over the last 5 years. So I'll walk you through this a little bit. I want to point out the green bar in the middle. You'll see there's a big hop that happens there. In that year, we transitioned some staff employees in the transit and human services to become employees of the county. So that led to a great increase in our personnel costs. It did not affect our total expenses as a county, as those were just a different type of expense at that time. So it was a bit of a wash. So you kind of got to throw that out as an anomaly. But so if we start at the green bar in the middle, so you can see, actually we started on the left side, you can see we did a 2% plus a step, then we did a 2% no steps, and then we did a 5% adjustment that year. So that was also a year we did a total compensation study for all positions, and everybody got a 5% increase through some way, shape, or form. It was 5+ typically. And then we did a 3.5% cost of living plus a step, and a 2% plus a step, and then a 2% plus a step. So that number across the top is the total cost of our salary and fringe. Inside of the top of that bar, you'll see the increase from the previous year. So as we kind of focus in on these last couple of years, you can see in 2024, that was a 2.8% increase. So that 3.5 plus a step was a 2.8% increase to our total costs. And then last year, it was about a $2 million increase to our salary and fringe costs. Now you go along the bottom there, there's a smaller number. That is the amount of additional levy that we added. So when we factor in that net new construction, say how much money are we getting out of that? Last year, that was $126,000. So our personnel expenses went up $2 million and our revenue went up 126,000. So part of that as we look at that is we need to come up with a solution that can align those numbers a little bit closer. And I want to say that is not our only revenue, right? We talked about the NDC, we have other grants, we have Medicare funding for a lot of the different services that we have or other grants. So out of our $100 million budget, the levy is 25 million. But it all depends on what it's funding and how that takes care of it. So this is what that kind of looks like as we go forward. So this is just projecting kind of the two options going forward. So as you look, then the numbers across the top are what it would look like if we continue to do a 4.75% increase, so 2% plus steps going forward. So you can see that that increases by about 2 million. It grows every year because of, I'll do Jenna's percentage. You can tell her I did that. They compound. And then kind of in the middle there, you see another number. I think it'll do this. Yeah, so you can't see my mouse, but the number right there is what it would look like if we did a 2.75% increase. So as opposed to, how did that happen? So yeah, that number along the middle is what it would look like at a 2.75% increase. And like I said, that 2.75 is a 2026 number. That's a number that you could change from year to year to align with our revenues. And you can see the difference. So going this route of a 2.75% increase would save, we don't like to use the word save because the money doesn't actually exist, but it is $986,000 that you wouldn't have to find somewhere else in order to provide, in order to provide those raises. And I think one of the things to point out is maybe the scary figure here is if you look at the 2020 total of 36 million and then look at the 2030 total of 62, it's doubling in about 10 years. So like I said, that you should read the ordinance, you should read your packet when it all comes down. But I think the big component of the change to that personnel ordinance that we're looking to make is in our proposal. And once again, all of these numbers can change from year to year. That's part of what the ordinance is doing, is taking that out and saying we're going to make a recommendation each year. Is we would do a 2.25% market adjustment. So that's moving the midpoints or moving those starting and ending points. And then we would provide a 0.5% for meeting expectations and 1% for exceeding expectations. Going forward, all of those numbers can kind of change with this ordinance change. The other options, if you were to stay in the current model, is if you did the 2.25% market adjustment, you have an option of 2.75% or 0. Those are your two options. So that's really the flexibility that we're trying to get through the ordinance change, is to say there's a number between 0 and 2.75 that is probably that best number for us to recommend going forward. And we're hoping to give the flexibility for ourselves and I think for the board as you go to try and balance the budget, to say we don't want to cut all of our employees' increases, but we need to find something somewhere. So where do we find that middle ground? And right now, I don't think the ordinance gives you that flexibility. All right, big change. Uh, and, uh, and so we have been spending our last 2 weeks, Sarah and Jenna and I, talking. This has got to be the 25th time I've seen this presentation. Um, so we sent out an email to the whole county with a video that what talks about the performance management and kind of helps employees through what that process change is going to look like going forward, and these recommendations of these changes and what the pay plan would look like in 2026 if approved. We've also been going around to every department and meeting with all of the staff, very similar to this, explaining to them what is going on, what are the changes, why are we making those changes. The slides that you're seeing right here are on the same slides that they're seeing in those meetings, to just kind of have those open and honest conversations about what is going on and why we're doing that. And we've continued to send out emails to the county, typically in the county manager's weekly email about the changes. As some of you have seen this before, the numbers were not always 2.75 and 3.25. They've gone up. And they've gone up because we have learned some more about what our WRS contributions will need to be for employees. And so we made an adjustment so that employees wouldn't be negatively impacted by that. We made the change to the people at the max scale to provide a bonus, and that's happened since we built this, and that's based on the feedback of the committee and administration. So those things are happening, and we're trying to communicate those changes as they happen through those channels. Once all this goes through, if it goes through, and well, I shouldn't say if it goes through, either way, HR is planning to build out some individual compensation statements. So think of that as really a document that says, here's what you're paid right now, and this is how much you pay for your health insurance. This is how much you pay for all of those different things. So kind of a breakdown of your pay stub that actually makes sense. And then we would provide another column of this is what it will look like next year, so that employees can really look at what that's going to look like and what their take-home pay will look like prior to the pay changes happening in the first paycheck. That includes January 1 or something like that. It's a really long thing in the ordinance of when these things take place. So that's a new thing that we're looking to provide. And like I said, that'll be provided either way. I think that's something that will really help employees understand where all of their money is going to. Then following that, we will do some town hall sessions. So going out and meeting with employees after the changes have gone in place to see how does it go? How were those meetings with your manager? Did your manager do a good job? Here's maybe some changes that we have identified as it went through that process that we're looking to make to that process in order to continue to make it better. And then we've continued to provide ongoing support, meeting to meeting with individuals, meeting with board members whenever they want to, so that people can have as in-depth of an understanding of these changes as they desire. And that falls on Sarah. So, and then we have another slide of this core values rubric, and I do think that this was a component that Sarah gets all the credit for, but I think what it really gets down to is some of the concerns that we've heard is the equity about how people are being evaluated, and not just internally, but between departments as well. And I think this is something that when you look at this, it is how you come to work. It isn't how much you work, it's how you come to work. Are you a nice person? Are you somebody that your colleagues want to be around? Are you looking to improve? Those are things that exist for every position throughout the county, and are something that we can really kind of focus on in identifying people that are meeting and exceeding expectations. In addition to doing your job, you got to do your job, but that's where exceeding is how well are you doing that, and how do you bring yourself to work. I won't go over this one. This one's really focused on the employees, but this is as we talk to employees and their role in that process is really to advocate for themselves, right? They get to go into those meetings and make sure that their manager understands how they feel and how they are kind of owning their own development. So kind of go over a lot of that with employees. So that is the slideshow. But I think the big thing is as we go through this, we have that ordinance change, and then in September there'll be some resolutions that are essentially the final adoption of those numbers. So walk you through that. Next Tuesday, the Committee on Administration will have an action item to approve the ordinance, the personnel ordinance, which will be renamed to the Human Resources Ordinance or something to that effect. And assuming they approve that, that will go to the county board for its first reading on July 30th. We do not have a board meeting. We have the budget workshop in August. We'll likely talk about some of how pay and budget work together through that budget workshop. But then in the September board meeting would be the second reading of that ordinance. If that is adopted, along with that will be a resolution to adopt the pay plan. And that'll also be the meeting that typically the health insurance premiums and those other items all come to the board in September for adoption prior to the final budget process, which pretty much gets frozen in October in order to get passed in November. So just wanted to give you a little heads up about what that is. It's a significant change, and we wanted to make sure that you all had an opportunity here to ask any questions.
Of course, I'd have one. Actually, it's not just really a question, but just a statement. As far as the dissatisfaction, that comes along with what people are getting paid and stuff, we all realize that you can never make everybody happy 100% of the time. You're always going to have some people dissatisfied, no matter how much you're paying them. And that isn't really it's not really contingent on what you're paying them. It's contingent on their heart condition, about the type of person they are, their character, and whether or not they want to do a good job. That's something that's totally outside of what you pay them, whatever. It's a matter of a person's ability to overcome their flesh and coveting what other people have and what they make and all that kind of stuff that goes along with what's in the heart of men and women. So you're never going to get everybody happy all the time. We all realize that.
Yep.
So the best you can do is look for employees that their character reflects that they're going to do a good job no matter what you're paying them or whether they get a raise or not. I've lived a life as a dairy farmer, which I never knew what I was going to get paid every month. When I opened up my check, I had no idea how much I was going to get. But that didn't stop me from giving it my whole heart every morning when I got up. And I've always tried to do a good job no matter what I was doing. When I was in the Army, I think you were probably in the Army too, or
No.
maybe not. But boy, when you're in there, you get up in the morning and you're only paid so much. That's all there is to it. And there was steps in there too for advancement, but most of it was done on time, or in times of war, you could get promoted a little bit according to the risk that was involved and stuff. But I witnessed all kinds of people that it didn't matter what their rank was, they gave it their 100% all the time, which was the kind of people you wanted in your unit. That's the kind of people you want working for you too, no matter where you're at, is you want people that have integrity and of heart. It's all about their heart condition. And so I would, encourage people, if they're struggling with their salaries and wages and being disappointed, I would address a little bit, meet with them when management is meeting with them to address the concern that they need to have to take a look at their heart condition and the way they respond to these things. And as far as the 2.75%, as long as we realize, everyone here realizes that the only money source that government has, it comes from taxpayers. That's how you generate income. And it seemed to me as I was watching this and as reflecting on what you were presenting to us that the levy can only go up. It's based according to how much new building that we require. So perhaps we could tie that the increase in salary to how much the levies could be increased, and that would seem to be fair to the taxpayer, and also it would give some form of incentive for workers to have an increase there as well, to tie it to that. So just a suggestion, something to be thrown out there for that or whatever, but just something that I was noticing as you were explaining all these things and stuff too. So
Yeah.
Thank you.
I wanted to share because I was curious the other day about how many people in the labor market in general are dissatisfied with their compensation. Like, how do we actually compare? And when you look at the statistics from Gallup, it's around 40 to 50%. And so, of course, we never want someone to be dissatisfied with their compensation. But as far as percentages go, we are actually doing better than the average when we think about that.
And I want to say something around our employee satisfaction survey. I don't know how much we've shared about that with the board, but we've run it for 2 years, and it just kind of closed up this last year. And as we put that together, one of the big things that we talked about was, if we're going to do this, we have to respond to the results that we got. So these items that you're looking at, some were shared as part of the performance management, and some of them shared in this salary thing. Those are the top 6 items of dissatisfaction in the county. So when we look at that, and everything is on its scale, but as we look at this and say, where are the areas where people are most dissatisfied? We felt from an administration standpoint, we need to look at those. People put in the time to fill out that survey. We need to take their feedback and we need to act upon that. And so that's why you see us focusing in on this is what our employees are telling us they want us to focus on. And so that's what we're doing.
Supervisor Story, did you have?
Yes. Statement, comments. First of all, very much appreciate this. I like this a lot. And I have been a little bit critical, I think, of the step system, but I am very, very happy with the work that you guys have put forward toward this. The other factors, though, that I would bring into this is that when we look at something as just a compensation salary for work done, it's almost impersonal, and you spoke to heart. But what I've come to find out, I guess, in my years of working is it's a matter of getting to know the employees on a personal level as much as you possibly can, because there may be something they're going through, something they're willing to share, something they're willing to not share that could be affecting performance or affecting attitude or temperament. But there's also other ways to show that appreciation for what they do other than just in terms of the compensation, in terms of salary. And a good manager will try and come up with what those possibilities might be. It might be just a fun day of some sort. It could be anything. But I think that when you're an employee, you certainly look to your salary and you kind of look at that depending on the workplace that you're in as a means of saying that they're satisfied with what I'm doing and they're happy with what I'm doing. But when you go above and beyond and again show heart and maybe again show a person an element of office fun or whatever, then I think that actually also plays into it, because I often found that or maybe I wasn't getting the compensation that I felt I was entitled to receive. If I was getting the positive, the other things within the environment, that was all I really, really needed, because that made me feel like I was worthwhile. That made me feel like I was doing a good job, because people were noticing that and they were complimenting me on that, or there were things that they were doing to show that. And it wasn't just the salary that was going to be telling me that. So I like what you're doing. I look forward to administration next week and seeing this again.
Mhm.
But I just wanted to make you aware of that. I know that the big thing for me, though, is always going to be that when you come to that insurance, is if that insurance number is going to all of a sudden play into that amount that they're getting, and it's going to just all of a sudden be way above, then we need to try and figure out how we can help them through that, because obviously that's a big deal these days. So that's all I have to say.
Yeah. And so part of, I have the flexibility slide up. Some of that flexibility is, I think, as we get to that premium. So a lot of times we set this stuff in place and then we get our premium numbers and we go, oh, that's what they are. This change will allow that flexibility that right at the Committee on Administration, you could say, I want to amend that recommendation to absorb that cost, right? You don't have that choice in the step, right? You got to pick another step in order to do that. So I think that's one of the flexibilities. The other thing I was going to, as you get into, why do people stay? Why do people, what are those other things besides salary that people stay in? So I was flipping through slides, and we don't have the the one that I was looking for on this. And I think Sarah said that the number one indicator of satisfaction with employment is employees knowing what is expected of them. And that's those conversations that we're trying to encourage managers to have on a consistent basis to make sure people know where they stand. And then as we talk about rewarding and some of those values, the other component in my life of that is you like coming to work if you like the people that you work with, and in a lot of cases, I was here for over 12 hours yesterday. We spend more time with the people that we work with than our own families. And so when you go to do that, you need to have people that you enjoy being around. And that's where I think building that team and to Supervisor Loeffler's point, like having those conversations from that manager standpoint, letting that person know, like, hey, you're getting your job done, but you kind of come in a little ornery every day, right? And what are those things that are going in? I'm starting to see this impact that whole team. People don't want to do that. And in a lot of cases, they don't even know that they're doing it. It's having that conversation and getting them to move forward, builds that whole team and strengthens the team and makes people want to stay.
And that goes back to what Sarah was saying about growth in a person. We all can have areas where we can grow. And that's an area that people, if they come in with an attitude like that, they need to grow in that area. And that will get them at a level where they'll be commended for the type of employee they are and stuff. If they come in with an attitude that way, which you're always going to get some people that will have that. However, through conversations or a good manager that can sit down with them and explain those things to them in a kind and gentle way, not in a condemning way, but just bring these points up to them and encourage them to improve on their attitude. Tell you what, a smile and joy goes a long ways in employment, both, and it's effective. You get a bad employee that's always complaining and it spreads throughout the rest of the employees too. But you get a good employee that's full of joy and they're happy, that spreads as well. You'll have a whole bunch of people then that are satisfied and willing to encourage each other. And I found that throughout my life, that the people that you have around that you surround yourself with and encourage to be that kind of person, to be a joy-filled person that is an encourager and not a discourager to people. it makes the workplace go so much better. And then secondary to all that is what you get paid and all the other things around that, you know, because it is really a condition of the heart in all of us, you know, that we need to examine ourselves once in a while and see how are we in our heart, you know, toward other people and even toward ourselves. And ultimately, I believe toward God, you know, I really think it has a lot to do with that, you know. So anyway, thank you for listening to me.
So I guess to piggyback on that, it's infectious to other people too that come into the workplace and see what they see. And I bring this up because I was at the eye doctor the other day and you could easily see that among that crew of people that they had a great time. And it was a stressful day for them. They were having you were sitting out in their waiting room a lot longer and all that kind of thing. But all of a sudden, the eye doctor decided he was going to throw something, you know, to that person down the hall. That person caught it. And you could just see the fun and the joy that was there within that office situation. And I said, oh, you guys have a good time, don't you? And he said, well, we try to. And that made all the difference in the world. And the other thing was I was going through stuff the other day as a result of my retirement, cleaning and different things, that I realized I had kept all my thank you notes that I had received from students, from coaches, from advisors, and from employer through the years. And I was reading through those, and I realized that where my children maybe felt that I was being taken advantage of or used or whatever, that's what they were seeing. They weren't seeing the stuff that I was seeing, the things that were making me want to stay there and to enjoy the job. So I really do think we're moving in the right direction.
May I?
Yeah.
So
Well,
will you
you
go
gotta
back
ask
to,
him.
will you go back to the money? You can do the 5-year forward or the 5-year look back. It doesn't really matter. So I just want to go back to Supervisor Lawford's because I think I think this is just so critical for county board members to understand. When we talk about the difference between 26 and 27 being 2.3 to 2.4 million dollars, we cannot raise taxes to do that. Period. That's it. We're done. I mean, we have to find it someplace else. So I think that idea that what our decision making will be an increase to taxes is not a possibility. So that's where. And yesterday we had one of the department meetings and had some what do they call them? Lively conversations. And partly it was that like nobody likes this. Like nobody's like sitting at home going, I can't wait to go to work and tell them that we can't spend any more money and we're gonna have to decrease our wages. Like that's not how it works. No one likes the reality of the fiscal picture that we work in, but it is our reality, and we need to figure out how to do that the best we can with what we have.
I heard this yesterday, but I still gathered more things today.
All right.
I think it was useful.
Right.
I probably heard it yesterday and it didn't all sink in.
Right.
So some of the rest of it sank in today. So I do appreciate,
Right.
I hope it wasn't on the floor.
Right.
Yeah. But no, it was really useful.
And I read the
and I appreciate it.
dissertation you shared. Literally, it was a dissertation. So,
Yes, I'm thinking.
I read the whole thing.
No, so I appreciate that, and I understand it much better now, and you've done a great job. And as I said yesterday, I really like the supervision evaluation policy, and I'm starting to see the flexibility now that you talk about building in with the salary. Theoretically, I assume that when we get to our workshop, the county board could say, oh, we don't think we need this service. We want to eliminate that service and increase the salary. And that's always going to be up to the county board. But you're coming up and giving a suggestion of saying, this is what we can afford. Okay.
Yep.
So that's it. That's just good job,
Yep.
all of you. And if I heard when I hear it a third time, I'm sure there'll be something else that I've learned.
Right. I think you're gonna get about 5 or 6. So, all right.
Chris, you're done? Anybody else? Well, I think that's it then. We get to move directly to adjournment unless there's an announcement of some kind. We are adjourned. 15-minute meeting, especially my fault. Oh,
Did you do what you said you were gonna do?